As cases continue to climb, the demand for the COVID testing rises with it. The State Department of Health says it's imperative to get the COVID vaccine to start slowing the spread. 12 News' Anna FARISH joins us now with more on their plea. Anna?
Well, as we know, the Delta variant is unlike any COVID-related thing that we've seen so far, and MSDH shows that we have far exceeded the previous peak that we saw back in the winter months and around the holiday season. And the Department of Health reports 89% of cases and 89% of hospitalizations are from people unvaccinated. State Health Officer Dr. Thomas DOBBS says we have seen vaccine numbers increase in recent weeks, which he says is a good thing, but the numbers really help in the long term as we inch closer to the fall. He says there are only two options for people at this point. One, get vaccinated, or two, if you get COVID, get monoclonal antibody testing because it could save your life.
We want folks who get COVID to make sure that they seek out and talk to their doctors or providers about getting monoclonal antibodies. This can reduce your hospitalization rate by 80 to 90%. It can markedly reduce your risk of dying. It's more and more widely available. We're working to expand our networks. We've added 10 different federal teams on the ground to help supply monoclonal antibodies that are being deployed. And we also have submitted a statewide standing order so that anyone who is diagnosed with COVID can directly seek care with monoclonal antibodies if they meet the criteria. And that way we don't have to go through a physician's visit. We don't want that impediment. And also for people who don't have insurance can go ahead and get with the center where they can be screened for appropriateness and be treated with these monoclonal antibodies, which are immediately beneficial and can save your life today if you get COVID.
State health leaders also encouraged anyone who is immune compromised to get a booster shot, but you should talk with your doctor first, of course. Now, Director of Health Protection Jim Craig says more federal relief is on the way. So like Samaritan's Purse and the DMAT team will have both set up those field hospitals out at UMMC to take on more COVID patients. He says the DMAT team was scheduled to depart sometime next week, but a new team will be coming to replace them. It's not been said how long that new team will stay. I'm Anna FARISH for 12 News. Melanie, Byron, back to you.